Good morning, YouTube. I am going to try and get my bench in view. Awesome. All right, let's wait here for Instagram, and then we'll get going. Good morning, PTO Nice Daily Show. My name is Dr. Ellison Melrose. We are live here on YouTube and on Instagram. I am faculty with the Dry Needling Division of ICE. So what I'm here to talk to you today on Clinical Tuesday about is postpartum considerations or some techniques for postpartum dry needling. And so if you guys missed it, I think it was 2 weeks ago, I hit the threes of dry needling during pregnancy. So what areas to avoid during pregnancy, when to not dry needle during pregnancy, and why it would be beneficial to use e-stim during pregnancy. So today we are switching gears a little bit and talking about it during the postpartum period. Before we dive into that, what I wanted to go over were a couple of the upcoming courses. So we just wrapped up in Georgia last weekend for a 3-day upper course, which was awesome. This upcoming weekend, we have another 3-day upper course in Baton Rouge, Louisiana. And then we have at the end of July, that's going to be our next upper course, which is going to be in Fort Worth, Texas. And that one's filling up pretty fast. So if you guys are wanting to get into an upper course this summer, those are the next two. Our lower body courses, we will have one at the end of June in Berryville, Virginia. So June 23rd through the 25th. And then mid-July, we have another lower body course in New Jersey, so July 15th and 16th. So hopefully we get to see you guys on the road this summer, and if not, into the fall. All right, so what I wanted to dive into was 2 reasons to integrate dry needling into your postpartum plan of care, and then 3 common dysfunctions that we see during postpartum that dry needling can help optimize our ability to load those patients. So the first reason is pain relief. That's going to be number 1 reason why most of us use dry needling in our clinical practice. And not only can it reduce the local modulation of pain, it can also improve our systemic autonomic pain mitigation tactics as well. So we have both local anti-inflammatory processes, but then also, especially when we're using with electrical stimulation, we have the opportunity to not only just treat the tissue of the issue, but also really help remap some of those cortical maladaptive properties that occur with any sort of injury. So that is number 1, is pain mitigation. And then the other is going to be improving those neuromuscular recruitment strategies postpartum. So we went over this briefly last podcast, but over the course of 9 to 10 months, our body adapts during pregnancy, right? So the mom's anatomy changes significantly to accommodate for a growing baby. And then over the course of 24 to 36 hours, typically, that baby leaves the vessel. And so a lot changes over that course of the 9 to 10 months, that then within less than 2 days, our body is trying to kind of figure out where it should be postpartum. And so a lot of those link tension relationships have changed over the course of the pregnancy, and some muscles may be a little bit not at their optimal length tension relationship for force production. So those are 2 reasons to use dry needling in the clinic. What we at ICE believe is that dry needling gives us this window of opportunity to load. And I think the postpartum patient population is one of those populations where we are maybe a little bit more fearful to load, especially in those early stages of postpartum recovery. So what I wanted to do today was go over 3 common dysfunctions that dry needling can help with, and then how to consider some loading in that earlier postpartum period, potentially if we're getting those patients early, and then how to maybe progress that into later stages as well. So number 1 we often see is what we would term nursing neck. So this is often kind of pain in the CT junction, upper trap area, thinking about posturally where moms spend a lot of their time. We are in this position here looking at baby nursing, but loading in that position, right? So baby can be anywhere from 7 to 10 pounds right off the bat. And so we're loading and looking in this really aggressive cervical flexion. So strategy to needle, we would suggest needling the CT junction and upper traps, but then also following this with loading. So loading the upper traps. Common way that we like to load the upper traps are going to be with some sort of heavy carry. And oftentimes during postpartum, we want to think about considerations for the pelvic floor. So I wanted to show you guys some ways to implement some loaded carries that are going to be a little bit put less pressure through the pelvic floor that we can get early in the postpartum period. So I have just a bench and some weights here. So we're thinking about loaded carries in that active scat position for loading the trap in that upper back. We also can implement some sort of front rack carry to address some of those upper thoracic spinal extensors as well. Thinking about that anatomical change during pregnancy, we get into more of this lordotic position. The upper thoracic spine doesn't have to load as much potentially during pregnancy. Then into postpartum, we come back here and we're spending a lot of time in that thoracic flexion position. So to take a loaded, sorry, it might be a little bit echoey here, but to take a loaded carry, we can put that into a seated position for our moms. So sitting is going to take some of that pressure off of the pelvic floor while still getting the loading through the upper quarter and even the core in this position as well. So it can look as simple as a loaded carry here. What I tend to do is do not symmetrical in weight, and that's going to replicate a lot of what our moms have to do in this postpartum period, right? We are carrying a baby in one arm, diaper bag or a screaming toddler in the other arm. So that's a great way to try and replicate that postpartum. So another thing that we can do here is going to be more of that front rack carry. Front rack carry on one side, farmer carry on the other side. Again, this can replicate a lot of what we have to do postpartum. A way to progress that from that seated position is just going to be standing and walking. A lot of these exercises can be done when baby is also exercising. So I like to use the time that we have where our baby is either doing tummy time or something like that, where we can be interacting with baby postpartum, but also loading the areas of dysfunction. So for nursing neck, what we would like to see is needling the CT junction and loading those upper traps. So the next most common area we see postpartum when our clients come in with pain or dysfunction is typically low back pain or SIJ dysfunction or pain in that area. And so what we would like to see is more needling the lumbar multifidus for things even looking down the line that looks like, sacroiliac joint dysfunction. Needling the multifidus can go a long way there. So needling the multifidus, and then also the muscles in the area that could help promote, blood flow to the tissue or improve that neuromuscular output. Again, we mentioned this last podcast, but that anatomical change where we come into this increased lordotic position, glutes are going to be not at their prime or optimal length tension relationship. So we can help recruit those muscles with some dry needling for neuromuscular recruitment. So dry needling glute max and min, as well as the lumbar multifidus for low back pain postpartum is where I would start there. And then we can go into loading strategies. So again, we often think about these really awesome or low back pain EMOMs that we can do, but we're fearful of maybe introducing those into our postpartum patient population. And again, a little can go a long way with this patient population. So a bird dog row is a great place to start. Again, it's not a ton more load than what they're already doing, right? As a new mom. And then also a hip thrust. And a hip thrust doesn't have to be something that's really loaded, but what it does do is it helps kind of get that glute max loading through a dynamic range of motion. So place to start for our hip thrust would be an unloaded hip thrust, and then progressing that more towards a loaded hip thrust. And then bird dog row, we can start with just an isometric bird dog row position. And why I like this more than just our generic bird dog is because it is going to optimize that length tension relationship in the trunk, right? So when we're elevated on a bench or something, it allows us to accommodate for that excessive lordosis that I think when we're actually doing just a bird dog on the ground, sometimes we often see those extension faults more often. So first thing we're going to do is just an isometric bird dog row, where we're using that weight as a perturbation. And then we'll also just kind of demonstrate that hip thrust, unweighted hip thrust. And then how to progress that would be first using our baby as a weight. So loading with just baby and then progressively loading over time as well. But so that first exercise is going to be the isometric bird dog row position. So you're going to set up with the weight on one side, contralateral to the hip extended side. So here's going to be really important to not allow that glute or that lumbar spine to go into that extension fault position. So even just here, one hand, opposite knee, hip extended, thinking about maintaining that rib cage stacked over the pelvic bowl. So this is level 1. Level 2 is going to be just adding a weight, right? So we're getting an awesome dynamic load into the core and the glutes here. Level 3 would be adding a little bit more perturbation and lat activation with our row. So bird dog row. We don't have to complicate our postpartum rehab. We can use a lot of the same exercises that we do for our low back rehab and just modify them slightly potentially for this postpartum population, right? So for optimal hip thrust, again, we are going to be thinking about loading primarily through that posterior chain, taking a little bit of that low back out of it. So we're going to maintain a flexed position through the upper back. So I'll show you that now. So we are going to have our patients place the bench right at the bottom of the base of their scapula. Here, feet in that extended position, our knees should make that 90-degree angle. And so we may be bringing those feet in a little bit in this resting position to accommodate for that. So from here then, in order to maintain mostly that glute activation, we are going to be maintaining flexion through the spine. So we're here. So this is unloaded hip thrust. Which is a great place for us to start for getting some loading through those glutes postpartum. Again, super easy for us to have our postpartum moms implement this into their daily movement snacks with their baby while baby is maybe doing some tummy time exercises of their own as well. So for sacroiliac joint and low back pain dysfunction during postpartum, we want to think about needling lumbar multifidus, glute max, and glute min, and then loading those posterior chain structures as well. Lastly, what I want to touch on today is mom wrist. So next week, Lindsay Huey is going to be going over a little bit more of some loading strategies for de Quervain's tenosynovitis, which is our common, which is the medical diagnosis for mom wrist often. So what I wanted to do was talk about that a little bit, but also I wanted to wrap in some carpal tunnel symptoms as well, because oftentimes with pregnancy, we see that huge increase in blood volume, which can lead to things like carpal tunnel syndrome, and doesn't go away necessarily right away postpartum. And then mom is loading again into a lot of these more flex positions, over gripping with holding a new baby, those type of things, and maybe a little bit deconditioned in that, upper back, shoulder girdle region. So both de Quervain's tenosynovitis and carpal tunnel syndrome are going to be two of the more distal symptoms that we see with our postpartum population. So for needling for carpal tunnel, there's going to be a couple different things that we can do. We can start right where the symptoms are, right? If we have symptoms in the hand, we can be needling that thenar and hypothenar eminence. Oftentimes, that's not usually the first place to start with these patients. The hand may be a little bit more sensitive. So thinking about proximal distribution of the median nerve, which could be the pain generator, or what we want to improve, tissue nourishment to. We can think about needling more of those proximal tissues like pronator teres and the flexor mass in the forearm. We also dive into some perineural circuit strategies during our upper and our lower courses. And these perineural techniques, they're not interacting with the nerves per se, but what we're doing is we're treating muscles around the nerve of interest and improving its excursion and its space and blood flow to the tissue. So thinking about how we can map some of those neurovascular structures that may be impacted, and doing a perineural circuit strategy around those tissues. So I don't want to give everything away from our courses, but that's kind of what we go into in our upper and lower courses of some perineural techniques that follow the distribution or the pathway of the nerves that we are trying to impact. So again, for carpal tunnel, that may look like some of the elbow flexors, pronator teres, and then thenar and hypothenar eminence muscles there. For de Quervain's tenosynovitis, so we're thinking about this being extensor pollicis longus and brevis impacted, right? Pain on that posterior aspect of the carpal metacarpal joint in the thumb. these are going to be some more advanced needling techniques. So we are going to be introducing those next year with our advanced concepts of needling extensor pollicis longus and brevis. And next week, Dr. Lindsay Huey will be going over some loading strategies for those muscles as well. So I just want to keep that on your horizon. So for future needling courses next year, and then also what Lindsay is going to be presenting next week. So let's kind of review everything that we went over today, because we went over a handful of things in a short amount of time. So we kind of talked about 2 reasons why to integrate dry needling into the postpartum plan of care. And one is that it's going to be one of the most efficient tools we have for pain modulation. So we can address not only local pain modulation, but also cortical changes as well, and autonomic changes with vasodilation, improving our ability to get new blood flow to the tissue, not only during the dry needling session, but also post dry needling with those autonomic changes as well. We can also take we can increase that neuromuscular recruitment, improve force output or potential for force output right after dry needling. So we're giving us this really awesome therapeutic window to load some structures that maybe went a little bit unloaded during pregnancy due to some of those anatomical changes. We went into 3 common dysfunctions that we see during postpartum period and how dry needling can help with those. We went over nursing neck, needling the CT junction, loading the upper traps, and how to do that in the early postpartum period, taking some of that pelvic floor load out of it. Sacroiliac joint dysfunction and low back pain. So needling the lumbar multifidus, glute max and glute min, and loading with modified bird dog row and body weight hip thrusts. And last but not least, we went over mom rest, right? So 2 different kind of variations of mom rest. Classic mom rest is going to be that de Quervain's tenosynovitis, which Lindsay will dive into some loading strategies there, and look out for those dry needling techniques in the advanced concepts course next year. But we also went into some carpal tunnel treatment as well. So needling proximal to the hand would be a great place to start. So some perineural circuit strategies with that median nerve. And then also making your way local or to the home base there in the thenar and hypothenar eminence as well. So ways to improve loading those tissues. We're thinking about nerve flossing for that carpal tunnel, but then everything that we did for nursing neck and even low back pain would be great opportunity to load this posterior chain or this upper quarter for the carpal tunnel syndrome as well. So loading proximally, thinking about improving strength of shoulder girdle and postural accommodations that occur during postpartum period. And then we're going to be looking out for Lindsay's podcast next week when she dives into de Quervain's tenosynovitis. So that's all I have for you today. Thank you guys so much for joining me on this Clinical Tuesday. I hope to be on here again in the future, but if you have any questions about anything that we went over or anything like that, just feel free to leave a comment down below, and I will see you next time.